All right, so some of you guys who know me know I've been having some issues battling with medial epicondylitis or golfer's elbow on the inner portion of my elbow. Turns out it's not tendonitis. It was actually a high-grade partial tear of over 50% of the tendon off the bone. That's the common flexor tendon that meets right there at the medial epicondyle, controls all flexion and pronation. So strength hasn't diminished because all the muscle's intact, but 50% of the tendon's torn off the bone. So I've gone through every procedure that you possibly can, and now I'm at the point where I'm at the doctor's right now for plasma rich platelet therapy, which is PRP. So I just got my blood drawn and they're spinning it out now. This has been a long process. I had to actually have 6 different appointments to get to this point. Had to have MRI done. That's how they found out that there was a high-grade tear. So they agreed to do that. They advised surgery over PRP, but PRP is also a good option, so we'll see. All right, so the PRP injection's done. I'll just give you a little recap of kind of my journey with this, explaining where it started. I think about 1.5 years ago, I felt a slight pop in my elbow during a long hook match, and not enough to bother me to the point where I didn't finish the match or the tournament, finish the tournament and everything else, and had a little bit of pain, but nothing notable. Kind of ignored it, the same as I do with most injuries, and just worked through it. Chalked it up to a little tendonitis and normal pulling pain. So over time it got a little bit worse, and really in the last 6 months it's really ignited to the point where it's gotten almost unbearable to train. So I decided to go ahead and seek some medical consultation. I'd already been doing pretty much any type of over-the-counter anti-inflammatories. I was doing thousands of reps of light recovery weight, like everything that you're supposed to do. Devin even talked to me about taking in a ton of fish oil, but nothing was resolving it. So I went to the doctors and everything, and I asked for PRP. There's a couple guys who have had some really good success with PRP with tendonitis in the elbow, and it's obviously used for tennis elbow quite a bit, and it's been shown a lot of good results, just not as much in the golfer's elbow, which is the medial epicondylitis. So anyway, I went to the doctor, highly recommended. They do ultrasound guided PRP on a regular basis. Basically, make a long story short, they said, we're not comfortable with giving you this PRP just because you tell us you need it. So they made me go through a battery of about 6 appointments. So I had to get an MRI, had to go to their physical therapist, had to come back for a follow-up, all kinds of stuff. But anyway, when they read the MRI and they took a look in the ultrasound and everything, they noticed more than a 50% tear in my common flexor bundle, which is all your finger flexors and your pronators meet right at that epicondyle. It's really everything that gives you any type of wrist flexion, any type of pronation, and all of your side pressure. So more than 50% of that was torn. It was kind of, the tendon kind of like rolled up a little bit and pulled back about 1 centimeter. The irony of the tear is actually dead center in the middle of the tendon. So there's 2 attachment points on the outside. So I think, just because I've been dealing with this for so long, they said, the training has probably gotten other areas to compensate to the point where I feel no real strength loss. It's just extreme pain whenever I flex, pronate, or pull sideways at all. So basically, for the Paul Talbot match, I got a cortisone shot, just thinking it was tendonitis. Got a cortisone shot 10 days before that, felt great until I warmed up. Warming up with Bill Sinks, it flared back up. Just fought through the Paul Talbot match, and it brought me to the point where I am here. Their first thought was they wanted to do surgery and anchor it back down, which that leaves you with a 4 to 6 month recovery time, and that's if you're being aggressive. So I tried to push for the PRP, which we got it done. So basically the PRP, took a little video before when I was in there, and I got a little video of the actual machine. What they do is they take out 40 mLs of your blood, which is not good for me because I'm a sissy with needles. I almost passed out. But anyway, so they draw out 40 mLs of blood and they spin it for 20 minutes. So they spin it in, I forget what the thing, centrifuge is called, and they spin out the leukocyte rich and leukocyte poor plasma platelet concentration. So basically 40 mLs gives you about 2 mLs of PRP. So that's the leukocyte rich platelets. So they usually want to put in, depending on how much they're doing, 4 mLs. So they take the leukocyte poor plasma and they add that to the solution, and then they go ahead and give you the injection. So fair warning on this PRP stuff. Know some notable arm wrestlers that had some really good success with it. I'll tell you this, it is not pleasant. So it feels like they're injecting a solid golf ball into your elbow. And that's after they give you the lidocaine. So it's pretty painful. I mean, nothing that you can't deal with, but it's right into that area where you're getting the pain. So normally they do what's called fenestration, where they actually poke holes into the tendon to cause more damage and have your body's natural healing process start working around that and create more inflammation, more blood flow, and actually helping the repair. But being that I had a high grade partial tear, which means 50% or more, they didn't do any fenestration on the remaining tendon, just to not damage it. So it is a low blood flow area, so they're basically pumping those platelets back into that area with your body's natural growth factors to help, your growth factors and healing factors to help repair that area. So basically they gave me a protocol to follow, which I'll include a picture of that on here for anybody. But basically it's immobilization for a couple days, a week of no real use on that arm. The following week go into a PT protocol that goes for the next couple of weeks. So basically the whole protocol is about 2 months, about 8 weeks of no table time or anything like that, which is going to be a pain for me. I think the biggest thing is going to be the mental aspect of not being able to train my total upper body. Obviously I can train my lower body, still do cardio and train the other half. So which I'll definitely be doing that, but I'm going to follow the protocol to a T, and we'll see how the results are. They said there was a reasonable chance that I could recover from this without needing any surgery, and there's also a reasonable chance that I don't get back 100% of a perfect scenario, but maybe I get back to a portion where I can still compete without pain. So that's really what I'm looking for. If I do wind up tearing the tendon, then we have surgery, and it is what it is. I just hate the idea of getting the knife if it's not an absolute must. So what I'll do is I'll check back in during this protocol period, and let you guys know how I'm feeling as we go. I've heard that you can feel some relief as close to 5 days and 10 days. I'm obviously not going to push that, but I'll let you know. I'll check back in and let you know how it goes. I'm really hoping this is something that works out and can work out for other people. All right. What's up, guys? So I'll do a quick checkpoint. Just driving back from the gym. So I'm 5 days out from the injection. So just to give you a recap on what I had that injection into my elbow. It was about 6 actual needle injections in and out or whatever. So afterwards is very painful and sore and achy because I guess the amount of fluid that was put in there and everything else, and directly into the inflamed spots. So for about 3 days it was real achy. Had 2 days in a sling, another day where I really just kept it immobilized, and I was able to still train. I'm training my left side, so like today I did chest and everything. I did everything on hammer strength stuff and just trained one arm. Same with all my normal arm wrestling stuff. I'm training my left. But in any case, we're 5 days in now, and the pain has pretty much subsided. Have not pushed my arm or done anything with it at all, really. So I can't really say the minute I go back to cupping or pronation, it might flare right back up. I have no idea. But I have an appointment for some physical therapy the end of this week. So we'll get to do some range of motion stuff and get some blood flow in there and everything. But I am going to take the full protocol, the 5 weeks off. But knock on wood, after talking to Craig Touye and some other people that have had this, they said about 5 days in you get relief. So it definitely is feeling good. Knock on wood. I know there's a ton of healing that still has to be done in there, with the PRP setting in and everything. Hopefully those platelets took hold. But I'm cautiously optimistic right now. I'll check back in after the PT appointment. All right, checking back in. So it's 8 days after the PRP shot. So just some notable things. I had my PT, my first PT session today, and I'll get to that. So what I did notice is about 5 days, 4 to 5 days after the injection, there was a notable less pain. So for 3 days, I had like an aching in my inner elbow, and nothing unbearable at all. Nothing like the actual injection itself. So no need for pain medicine or anything like that at all. After about 3 days, it subsided. There was still a little bit of tenderness. After 5 days, there was not a whole lot of pain in my elbow at all. So I'm not sure if that has a whole lot to do with me resting it completely and not doing anything in the gym at all. So, but all things considered, it felt really good. And it still feels really good right now. So I had physical therapy. Before I even go into that, I have been continuing to train. I've been training my left side and my lower body for the entire time. So that's eight straight days of training, but with absolutely nothing on the right arm. Like, I'm not even picking really anything heavy up, not flexing. And like for the first 2 days, I had a sling on, and the next 3, I really didn't pick anything up with my right arm at all. So been following the protocol. Left arm, I'm training that the same. Lower body, training that the same. So go into PT. Everything was very, very simple. They wanted to work on range of motion for my elbow, like bringing it back like the whole way here. So 30 reps of just bringing it as close as I can, 30 reps of extending it as far as I can, and then 30 reps of pronation, supination, just running back and forth. So I don't have a whole lot of pain in any of those, and they're real basic. So I'll be doing a week of like, I think it's 5 sets of 30 on each of them. I can do them at any point in the day. Hardest part for me right now is not being able to train my body like synergistically and completely. So that's a mental challenge for sure. I'm going to continue to train my left side, and I am doing all the core lifts. I'm still doing dumbbell bench press with one arm, and but I have to do that because my OCD forces me to. But in any case, the toughest thing is just not training and then watching my right half atrophy. So that's tough. But all things considered, right now, knock on wood, I have no pain. So pain is one thing, healing is another. So the next few weeks of the protocol for physical therapy they're going to eventually call for Graston's, which is scraping. So that's to help rearrange the tendon alignment, like the fibers of the tendon. So when you damage your tendon, the fibers get all confused with scar tissue, and they don't run linearly or parallelly, however they say it. But the scraping is supposed to realign them. Hoping that's going to work out. I'll check back in a week or two. And we'll see how it goes. Really, the ultimate goal is to take a look at the ultrasound later on at my final follow-up visit, which is going to be 5 weeks past the injection, to see if the actual tear started to close up. So we'll see. So here we are, just finished up, went through my 3rd week after the PRP injection. So this was my 2nd PT. I went 2 weeks over the holiday. We didn't do the PT. So the protocol called for a little bit of scraping and a little bit of active resistance in this PT. So basically, I got the Graston's knife and whatever they are, and they scrape over the tendon and try and realign the fibers. So that was real basic. It wasn't painful at all. I still haven't had really any major issues. So they cleared me actually to do some active resistance, so I'm able to start using a wrist wrench again, start pronating and supinating with extremely light weight, 25 to 30% intensity, and even lower weights than I would normally do with that. So it's less actual rehab and blood flow for the tendon and more geared towards just getting that range of motion back. So I did that for 1 day right after the PT. And I did get a little bit of tenderness in the elbow, like I could feel that connection point, but no pain. So right now, I'm still cautiously optimistic. I mean, it was an interesting feeling, that I could still feel that that tendon insertion point on the medial epicondyle. I could feel that connection was kind of irritated, but nothing pain-wise, nothing like it was before. So can't train my body symmetrically yet. So no real core lift or heavy loads allowed right now. So all I'm really going to be doing for the next week is pronation, supination, normal rise, sink. I can do some hammer biceps very lightly. I'm going to do some band work and things like that. The following week in PT, I believe I'm going to get Grastins again, and I'm hoping at that point that they're going to go ahead and clear me to train my body symmetrically, because I'm tired of being that guy in the gym who's benching one dumbbell. But yeah, we'll see. I think I have 2 more weeks before I see the surgeon again and review and see if the tendon actually healed at all. So as far as that goes, I'm also taking like pretty much every natural supplement that you can for tendon health. So I'm taking a collagen, different collagen pills and collagen powder. I'm taking basically a joint compound. Glucosamine and all that stuff, just a normal joint compound, taking a ton of fish oil, and pretty much every basic herbal supplement, cysts, the things that are going to hopefully help tendon and soft tissue regenerate. So I'm trying to hit it from all angles. I guess we'll see in a couple weeks, but so far no pain really. So we'll see. All right, I just finished up my 5th PT session. I guess it was 5th one. So I'm 5 weeks into the protocol, which is potentially my last PT. So basically where I'm at now, the previous one, they cleared me to do some like total body training. So finally I can train symmetrically. So the past week I've been doing some presses at 50%, some pulls at 50%, but not over the top challenging flexion and pronation or anything like that, beyond like 50% intensity and 50% volume. So what I have noticed is pain is still much lower, much less sharp pain, but I can tell once I finish up that workout that there is a little bit of a tender point and like a feeling, you know, in the connection of the elbow. So it's not sharp, it's not intense pain like it used to be, but I can still feel some type of discomfort in there. So I'm cautiously optimistic still. So PT today, all they really did was some stretching, a little bit of light load work, and Grastins. So I've been getting Grastins for the past 3 appointments, and now this coming week I'll go back to see the ortho, and they'll go ahead and take an ultrasound and compare it to the one they had before to see if there was any bridging of the tear. So hopefully there was some bridging and some healing, and if so, I think I'm gonna go ahead and make a decision at that point whether I'm gonna need surgery or I'm gonna continue down this path. So I'll check back in a couple days. What's up, guys? So we're a little over 9 weeks post PRP injection. I actually skipped my previous appointment with the regular doctor. The follow-up on that was real simple. He wound up just telling me, hey, you know, your pain's down, blah blah blah. I want to send you back to the orthopedic surgeon to get his opinion on what to do next. So basically, in the previous appointment, I explained to the doctor that my pain had come back after arm wrestling. I practiced a good bit with Sam and Storm, and the pain came back, but it definitely wasn't nearly as intense. So he said he guaranteed me that there was definitely some sort of healing going on in there, and that he wanted to keep riding it out to give it 3 months. So I spoke today with the orthopedic surgeon. He said basically he doesn't want to re-image and do another MRI until I am successfully out 3 months. So that'll put me at about 4 more weeks. And in the meantime, he put me back on a slight anti-inflammatory meloxicam. He told me to go about arm wrestling practice and training as I normally would, and we'll reevaluate after the MRI. He's pretty confident that there's definitely healing involved. We don't know if it's full healing, but the pain level where I was at before was probably about an 8. I would say I'm at about a 6 or a 5 now. So it's not 100%, but I think it's definitely improved. I guess we'll have to find out in about 9 weeks when I check back, or in about 4 weeks when I check back in for that 3-month MRI. So it'll be an MRI, and then I follow back up with the orthopedic surgeon. We figure out where we can go from there. So so far so good, I guess. So got my appointment scheduled. I'm gonna have the MRI in early October, I believe October 4th, and then have my follow-up on I think the 12th or the 14th, I can't remember. But I did want to mention that the doctor did confirm after speaking to him on the phone that an additional round of PRP is definitely an option. pending, you know, the healing in progress. So I also wanted to mention too that, you know, up until this point, PRP is normally not covered by insurance, but I have Blue Cross Blue Shield, and believe it or not, it did cover it. So basically it's a, you know, anywhere from $700 to $1,000 injection that was covered. So I pretty much got that for like $70. So with that being said, I'm definitely leaning towards another round of PRP, and maybe just looking into dealing with it that way and going through the protocol again. Don't like the idea of taking off another 6 to 8 weeks, but if that's going to heal it completely or get me even in better standing, then I'm good with that. So I'm not going to I'm not going to add on anything else to this video. I think all things considered, I'm looking at this as at least a moderate success. I will make another video. I know this is getting long, but I will make another video afterwards separately when it's all said and done, and I get myself back to the best competition shape that I can. And I'll kind of check back in and let you guys know what my final take on PRP is. But I will say that the whole idea of PRP seems very, very promising, and I definitely do think I did get positive results from it. So if it's something that you're dealing with something similar, you know, chronic tendonitis or tendinopathy, I think doing some basic research and seeing what's available around you is definitely a good idea. So like I said, I'll go ahead and make another video when it's all said and done and kind of give you my final thoughts on everything. But thanks for tuning in. Appreciate you.